Now here is just serratus anterior by itself, so it's just isolated here. And what serratus anterior, where it's going to be originating, is on the tops or the superior margins of the first 8 ribs. And you can follow the fibers and see that it's inserting all along the medial or vertebral border of the scapula. That's kind of what this dotted line is showing you here. What serratus anterior is doing is it's causing abduction, abduction, and also lateral rotation of the scapula. The nerve that will innervate serratus anterior is called long thoracic or lateral thoracic nerve. And in reality, with all the other musculature put together, you only see a little bit of serratus anterior. And what it's going to look like on the body is it almost looks like little fingers or knives that are sitting on the outsides or lateral aspect of the ribs here. And that will be the serratus anterior muscle. Now, working on muscles of the rotator cuff, you've probably heard of the rotator cuff before this class. Lots of sports athletes have injuries to the rotator cuff, but the rotator cuff actually has 4 different muscles in it, and it has a couple of other parts that we're not going to get into. We're just going to focus on these 4 muscles. The first one's called Subscapularis. The second one's called Supraspinatus. The third one is Infraspinatus. And then the 4th muscle of the rotator cuff is called teres minor, and that word teres just means round. Now, these first 3 should look kind of familiar with that terminology, and they're named after the fossa of the scapula that they are actually going to originate on. So as we take a look, from this view, we are actually looking at an anterior view of the scapula. So we removed everything, just going all the way to the anterior side of the scapula here, and that's where we see subscapularis right here. And so subscapularis is going to be originating in the subscapular fossa. If you follow the fibers over, where it's actually going to insert is the lesser tubercle. So it inserts on the lesser tubercle of the humerus. And what it's doing is it causes medial rotation of the humerus. The nerve that's going to innervate subscapularis is just called the subscapular nerve. Looking at the posterior views, where we're going to see the other 3 muscles of the rotator cuff. And so first one, supraspinatus. Here's the spine of the scapula. When you're working on a cadaver or with pictures or anything like that, when you're looking at this view, the spine of the scapula is actually just superficial, and only the skin and a muscle called trapezius really kind of cover it at all. So once the skin is removed, you can see this feature very clearly. So use that to your advantage, as it's a good landmark to help you figure out where you're looking at. So supraspinatus is going to sit above it, and it's going to originate in that supraspinous fossa of the scapula. And if you follow the fibers over here, it's going to insert on the greater tubercle, which we can actually see the greater tubercle right here, of the humerus. And what supraspinatus does is it causes abduction or abduction of the humerus. The nerve that's going to innervate supraspinatus is called suprascapular nerve. Working on infraspinatus, this is going to originate on the infraspinous fossa, and it is also going to come over and insert onto the greater tubercle of the humerus. What infraspinatus does is it causes lateral rotation of the humerus, and it's going to be innervated also by suprascapular nerve. And then our 4th and final rotator cuff muscle is this tiny little muscle right here called teres minor. And teres minor, it's actually going to originate on the axillary border of the scapula. And more specifically, it's going to happen above the inferior angle. So along this axillary border, above the angles where it's going to originate. Follow the fibers over. It's also going to insert on the greater tubercle, and it's also going to cause lateral rotation of the humerus, just like we saw with infraspinatus.